Hey there and happy summer. CCI is taking a break this August. During this organization-wide closure, CCI staff are planning to unplug together, rescheduling activities, snoozing notifications, and turning off screens. If you're also looking to unplug, you should find today's episode particularly compelling. It was first published last year and is one of our most popular episodes. It's called Readiness, Response, Recovery, and Renewal. Enjoy.
If you are someone who is in a leadership role in particular, to make sure that you spend time reflecting and spend time in really deep observation of what's going on with your staff and making a decision to be trauma-informed in your actions.
Welcome to the Health Pilots podcast, presented by the Center for Care Innovations. This podcast is about strengthening the health and well-being of historically underinvested communities. Every episode offers new ideas and practical advice that you can apply today.
I'm Alexis Walensky. I'm a program manager at the Center for Care Innovations. Today, we're talking about the 4Rs framework, which covers the different phases of the pandemic: readiness, response, recovery, and renewal. Our hope is that this scaffolding can help health centers and other safety net organizations navigate the crisis. I'm here with Dr. Irene Sung and Dr. Ken Epstein, two of our coaches for the Resilient Beginnings Network, a partnership between the Center for Care Innovations, Genentech Corporate Giving, and 15 Bay Area safety net health systems. The Resilient Beginnings Network is a learning program dedicated to advancing pediatric care delivery models that are trauma and resilience informed. And today was my son's second day back in the classroom in over a year, and he just got back from school.
Alexis, that's wonderful. This is exactly what we're talking about. We're talking about moving back into renewal, which is definitely one of the pandemic phases. I am Irene Sung. I am a child and adolescent psychiatrist by training and recently retired from San Francisco's Department of Public Health, where I've held kind of multiple roles, both as a child and adolescent psychiatry clinician and up into leadership positions, including overseeing behavioral health services.
Alexis, congratulations about your return to school. I can't imagine emotions of having your child back in school. I'm Ken Epstein. I'm a social worker. I had the honor and opportunity to work with Irene for almost 3 decades, and which is being old, I guess. And I have worked in both the nonprofit and public sector as a leader, a clinician leader, and clinical faculty.
Thank you both for being here. Really looking forward to this conversation. You know, we recently marked the 1-year anniversary of the COVID-19 pandemic. So in that context, tell us more about the 4Rs and why are they important?
So let me just start by saying when last March came and soon after, I remember a lot of folks, Irene, saying that we all were experiencing this common adversity, that we all now for the first time we're experiencing something the same. And I want to start by saying that this year has been a year like no other. And for many people, this year has been a year like every other. As a white man, as a person with privilege, I have experienced adversity. And at the same time, for those people with less privilege, Black and brown folks, this year has represented a year of both a year like no other and a year where the inequities that are experienced by folks that are at the margins or are disenfranchised have been shown by COVID and all of the other events of this year. When Irene and I get together last March, we were operating under the idea that we really needed to think about what are the phases of the pandemic. And we looked to and across the country, and there was the Missouri model, pandemic response, which had readiness, response, and recovery. And then we found the school model, which about school violence that had renewal. And I think today's talk, Irene, is really to talk about our work and our transformation around thinking about the 4Rs.
So I appreciate that, Ken, because I do think that everyone at the very beginning was saying, oh, we're all in the same boat, right? That was the concept. And as we were talking with different organizations, really shifted that from we're all in the same storm, but we're in very different boats. And that's really important to remember. Some of us have very big cruise liners to weather the storm, and then some have little dinghies. And so it's just important to remember. The 4 stages of the pandemic, and if you Google this, you'll see multiple stages. And we really were focusing on what are kind of the emotional stages of the pandemic to help understand, because as people were traveling through, people were moving so fast and things were getting so chaotic, and that what we found helpful was to build some cohesion around understanding what people were experiencing as a way for them to move forward. So the 4 stages, if we go through them one by one, would be what you described: readiness, response, recovery, and renewal. Readiness is what we all understand. We, at some level or another, get ready for something. In California, I think everyone knows how to get ready for an earthquake. Everyone has heard duck and cover, for example. Some schools have prepared for school shootings and have created some readiness aspects to just being ready to respond. I don't know how ready we were for a global pandemic, but we understand the concept of readiness. When the pandemic hit and became more spread, people moved into response mode. And response, they had to move very quickly. And you saw healthcare organizations move very, very quickly, beefing electronic health records up so that staff could provide telehealth from home, moving to online care, insurance companies allowing for online care to be provided to their members. There's so many things that happened during readiness response very quickly. And I think that response was amazing. It was quick, but also create a lot of stress for staff. Now, recovery is a point where you start to get to like a place of evenness. Like you responded and then you can recover a little bit, build some sort of schedule for yourself, build some sort of way of doing your work, some sort of workflow that actually creates some sense of like, okay, I can do this and I can sustain this. And then the last piece of renewal is being able to look back at what you've learned through the process and understand what worked and what didn't. So things were not perfect before we went into response mode, but there are things that work that we want to hold on to. And then there are some things that we've learned that maybe we also want to hold on to or we want to create in the phase of renewal so we can get to a better place for ourselves, for our patients. So that is the cycle that we are talking about, and we are helping people understand so that they can kind of have some cohesion when they think back about like, what did I just experience?
Irene, you started by saying we took these ideas from places that saw these as substantive or content areas. So readiness could be, do you have protocols and procedures? And do you have in place a way to deploy staff? And do you have in place, as it turned out, the ability to test or vaccinate? There are a number of ways in which disaster response people would look at readiness. Recovery might be your ability to mobilize quickly, to be able to move quickly. And it's a very top-down approach. And, response would be that. And recovery would be practice sense of like, are we getting back to quote unquote normal? And renewal, what do we want to keep? But from a psychological perspective, Irene, which is where you started, readiness is a little bit different. I was thinking as you were talking, I remember on March 6th being in the airport. And I remember at that point, Wuhan had happened and there had been an outbreak in Washington State and there was an outbreak in New York. And I remember seeing people in the airport with masks. And I was thinking, why are they wearing masks? I don't know why they're wearing masks. Well, it turns out that the people that were wearing masks were ready. They had experiences or understood the pandemic psychologically. I was not ready psychologically to wear a mask. Now, we know that's been a debate across the country around masks. And you think about it, we didn't get our country psychologically ready to wear masks because many people were provoked about being on one side or the other of it. Was I psychologically ready? The answer would be no, I was not. It was a shock. I had never been in a pandemic before. And if you're a leader or you're a physician or you're a nurse, the question is, you probably or might have been ready from a protocol perspective, but were we ready from a psychological perspective? And what we learned is we were not. And we did not think about that. And if you think about response, were we ready psychologically for what it would take to give up and lose the things we had to give up and lose to respond? Not seeing people, not being able to go to funerals, not being able to go to weddings, not being able to go to work. The things we had to lose and the collective grief we experienced as a nation and as a people, which was increased dosage-wise based on inequities, that collective grief that rose in the response level was unaddressed. And so as people were responding protocol-wise, they weren't addressing the collective grief. And you begin to see the generation of rage and all sorts of feelings that come out that Irene and I have been navigating with healthcare professionals across the state and the country. And then you think about the recovery phase. Well, the recovery phase from protocol would be, I got back to work, I'm not deployed anymore. Recovery is also about, how do I heal from the wounds of what happened during this time? How do I attend to the staff that are alienated and disassociated? How do I tend to the folks that have been, dealing with their kids and their family and their homes? And then the renewal phase is, wow, I learned some things about myself and my resilience and my work and what we've done that are amazing. And can we keep it? Will somebody support it? I've learned that I can actually work from home and be at work, or I could work differently. And can I keep it? So when you think about those phases structurally, you think about them as practical. When you think about them psychologically, we begin to think about the workforce. And we need to attend to our workforce around these phases. Otherwise, we will, and we're already experiencing the kind of burnout and trauma and crisis in our workforce that we're seeing in nurses leaving their jobs, people feeling extraordinary stress, teachers not wanting to go back to work, and so on, because we need to attend to the psychological impact of this crisis.
It made me think, Ken, also about the importance of the phases and understanding it's not going to necessarily be linear. Yes. You don't move from one to the other. You can move back and forth. And one of your staff could be in one phase and you could be in another phase. And to make sure, keep that in mind as you have the conversation, because you can't rush renewal. You can't just move into, okay, what have we learned? We're going to do something great, without attending what Ken said to where folks are in their process. And so to really be mindful of that, especially as leaders, to not just push it forward, to actually step back and pay very close attention to what's going on for your staff.
So the phases of the pandemic go readiness, response, recovery, renewal. Why is it so hard for organizations to move past the second R? Why is it hard to get past the response phase?
Well, I think one piece is things keep happening, so you first, I was talking with an organization who's up in the North Bay, and they say it's kind of one thing after another. And so there's the pandemic, and then kind of Black Lives and racial reckoning, and George Floyd and that, and then the wildfires that they have to deal with. And then, the election, and then the insurrection, and now the anti-Asian violence. So it's like constantly being bombarded with things that keep happening that you have to keep responding to. Some of it is not logistic response. This is just psychological response, right? Another thing to have to deal with. And then there are the good things, but there's still things they have to respond to, like the vaccines. They're healthcare organizations that they have to figure out how we're going to roll this out and how do we do it equitably. So I think that is one thing that is making it harder for them to feel like they can take a moment to recover.
I so appreciate that story, Irene, about the ongoing stress. And I was thinking as you were saying that story that the truth is we may not do something about it, but if things were radioactive, we would understand as a country that radiation is bad. And if there was lead in our water, in our houses, we would understand that that would be dangerous to our health. What Irene's talking about is the stress that is related to an unending amount of traumas that have happened in this country in the last year that have escalated, as I said in the beginning, an already existing trauma of inequity in our country and structural and historical racism. So I think the question is why it's hard to move from response to recovery is because it's hard to listen to the pain. It's very hard for people to reflect in reactive spaces. I often say, our organizations are reactive places, and yet change only takes place in reflective spaces. So unless we find reflective spaces and reactive places, we won't find the place or the ability to listen to the pain. And there's a book written by Terry Gross that she said, all I needed to do was ask. I think it's something like that, or all I did was ask. I often feel like that way after I work with an organization and I have one prompt and I say something like, how are you holding up? Or what's on your mind? And an hour and a half later, people are telling their story. They're beginning to be heard. And why are they doing that? They're doing that because we need to keep in mind, in general, trauma destroys relationships. We've been all about self-care, and self-care is important. I'm all into self-care. But the idea of self-care is that I'm going to go out and do something by myself. And if I'm not doing it in some way, I should be shamed or blamed. And, if I'm doing it, I'm actually getting better. But the truth is that's important, but not essential. What's essential is that we collaborate, that we're in it together, that we're coming up with solutions that are inclusive and together. So the recovery phase is complicated because the recovery phase is about recovering from the psychological sequelae of being in a collective trauma. And we need to address that with all of our knowledge that trauma happens in the context of relationships and it's healed in the context of relationships.
I think to even just this morning, and we were working with an organization, there is this space of allowing people to tell their story. Like that is just so important. There is just so much relief, and it makes you realize how little space there is for just telling someone how it is you're doing and how it is that you're feeling, how it is that you're holding up to this process. And it seems surprising, but it's true. We just say, how are you doing? And the response is fine, or good, or, and that's it. But if you actually allow people the space, there's a lot of healing that can happen just in that. So you don't have to be a professional to actually ask someone how they're holding up. This connection can happen day to day with all your coworkers, with all your loved ones. It can happen. And that's going to add to moving away from response into recovery.
And one thing I just wanted to add, Irene, I'm so glad you said that thing, because I don't know about you, but I can't tell you how many times as a leader somebody said, oh, you're such a clinician. Or I can't do that. That sounds like therapy. And here's two things about that. One is therapy works. So the point is that it's good to think about how we heal in the context of relationships. So we all should learn it. If we wanted to learn first aid around the cut, we'd want to put a Band-Aid on it. If we want to learn a first aid around healing, we should put a relationship around it. And so in that sense, everybody should learn it. It should be a skill for everybody. And I think, Irene, you said it straight up. It doesn't take a degree to ask you how you're holding up, sit forward and listen and tell somebody, thanks for being comfortable enough to share that with me. Because people say, wow, that you just see their shoulders go down. So important. So I so appreciate that in terms of the skill set is one in which does not have to be embedded in a therapist or a psychiatrist or a social worker, but one in which all of our professionals should be helped to ask those questions. And it's the core of recovery.
So I'm wondering, how do we get from, where we are now into this place of recovery and renewal? Are there specific practices, trauma-informed practices, or things that leaders could be doing at a more organizational level to help move through those phases?
I want to just give a cautionary tale and then a next step. And the cautionary tale is that we're a people that are looking for simple tools and step-by-step practices and ABCs And there's sort of an expectation that everybody's going to go through this process the same way. And I just want to be very, very clear that there are so many responses to what's happening. And if we begin to punish someone's response because it doesn't fit the organizational tool that we've developed, we're going to be our own worst enemy. And I worry about that. I worry that, you'll go to the airport and there'll be the 10 steps to recovery, the 6 steps to, you'll see a series of books about, I succeeded because I did these 5 things. There'll be a formula for this. And I really, really worry about simple solutions to a complex problem. So even in answering your question, I want to humbly say, I wish I could answer your question with a simple formula, because I don't think you can solve complex trauma, this kind of collective trauma, this kind of collective grief, with simple solutions, that will come up with simple answers. So that's my caveat to answering your question.
I'm going to jump in before you move on, because I want to second that and to say there are tools, but that these tools should be used in the context of your own humanity, right? So if you are someone who is in a leadership role in particular, to make sure that you spend time reflecting and spend time in really deep observation of what's going on with your staff and making a decision to be trauma informed in your actions. So this is the piece that you can't script it, right? You've got to be you, and you've got to be careful not to react, but to make sure you're reflecting and observing what's going on around you. And if you're not sure, don't move to do until you actually check it out and you connect with people to make sure that you're not moving too fast.
I do think there's plenty that organizations and teams can do. And many of them are doing it already. Many organizations are reaching out and have been incredibly creative during this time and all along. There are 3 things that I've heard from people over and over again as I've gone around. One is people are exhausted, physically and emotionally exhausted. The second is they're overwhelmed because their lives have changed so dramatically and their jobs have changed so dramatically. And the third is they're confused and scared about what's happening and what's going to happen and what will happen. But I want to talk about 3 R's and 3 C's. 3 R's we talked about 4 R's in readiness, response, recovery, and renewal. If you have a workforce that's exhausted, dysregulated, and overwhelmed, you actually want to figure out how to build in rest. You want to figure out how to build in recalibration, and you want to figure out how to build in regulation. And what I mean by those 3 things, and then I'll talk about some practices that you can do it, is what I mean is that telling somebody they could go on vacation or they need a vacation and then giving them more work does not create rest. So structurally, organizations need to think about how to build in. I actually know, Alexis, that your organization recently gave you 2 days off, for example, right? Because they knew that people were getting vaccines and they knew that there would be side effects. And I thought that was really just incredible foresight of an organization to doing things like that. Many are not. And so I get a vaccine, I have an after effect, I'm still working, and there is no recognition that we're trying to do that at the same time. So understanding that we need rest, that we need time off. The second thing is we need to recalibrate, because if we're going to experience rest, we need to think about those 3 jobs we took over in March, the 4 people that weren't hired, and the ways in which we're deployed or still deployed. We need to think about what is a job now, 13 months later, and how are we going to do that in a sustainable way? Because the job I had in March is not sustainable. Examples, just many of us last week, sadly, I spent 19 hours on Zoom between Monday and Tuesday. I mean, that's my own choice, but the problem is that's the workforce is doing that over and over and over again. There aren't breaks between Zoom. I saw that UCSF put out a memo last week that all meetings should be 50 minutes and there should be a 10-minute break between the meetings so that people actually have a time to recalibrate, to sort of rest and not go, because now more than ever, as we're not commuting, we're not resting. When, there was a way in which even if I walked to Irene's office, it was a 2-minute walk, but I had a 2-minute walk to Irene's office. Now I want to talk with Irene. We're Zooming at 9:00 at night and 10:00 I'm going to bed, So it's just the world has shifted because we have this access to each other. So we have to take that into consideration and recalibrate. And then we need to regulate. We need to build. And then what I mean by regulation is that trauma causes dysregulation. Dysregulation causes symptoms like my breathing, my tightness in my neck, biting my lip. I get an embodiment of trauma and it makes me not well. And so we have to help our organization regulate, which means that we have to do things that help people organizationally calm down. So I'll give you the 3C way of doing that. The first one is connection. There are actual things you can do about connection, even on Zoom. There are people doing creative things like random coffee check-ins on Zoom, if we're on Zoom. Somehow we have to create, the water cooler. We have to recreate walking by in the hall. You can't do it the same way. Some people are having outdoor meetings if they're allowed to have it. The other connection activity is checking in. Because if every meeting started with something, not a 50-minute check-in, but a mindfulness check-in or something that gets people in the room, in the Zoom, in the place, even if you're working on site, that gets you regulated so that before we start talking about the budget cuts and the new memos and all the things that are going on, we're trying to bring people in the room so they're off their emails, off their texts, and with us. It's very important to be in this space. Other connection activities could be acknowledgments, gratitude practices. We did a gratitude practice today with the group, and you could just feel the whole tension in the group shift. Irene and I did this, and it was the last 6 minutes of the meeting. It was a very, I'd say, intense meeting, lots of feelings. And in the gratitude practice, you could see people saying gratitude to each other or their mom or the team, and they regulate it. And so they can go on to the next thing. Do not send your work staff out after a meeting or a supervision or an activity. Dysregulate it. Doctors can do it with each other. Nurses can do it with each other. So that's the connection activity. And there are many others you can do. Acknowledgement practices. You can have people have started sort of each day having a theme. There are lots of creative ideas, and many of them we have on our website on ELSF. The second one is coherence. Now, coherence is really about there being spaces to reflect. As you heard me say before, we live in reactive places. We need to create reflective spaces. This means that in our organization, during our workday, not after, not as homework, not on the weekends, not in the middle of the night when I'm waking up, but in our organization, we need to figure out places and spaces where people can have reflective practice. They can talk about what's going on for them and not be told that it's not going on or they don't have time for that. Because the more we reflect, the more we can reintegrate and become part of and become more coherent. And the more we reflect, we can make sense out of the chaos. So those are, it could be a 20-minute check-in about what's on your mind. It could be a 10-minute conversation. It could be an email asking somebody how they're doing. Or it could be, as Irene said, tell me a story. Let me hear, or remembering that somebody's kid went to school this day, or that they missed their child's graduation or wedding. Those are all things that build coherence to the chaos. And our workforce and our organizations have to honor that and create space for those stories to live and breathe and be honored. And the third one is collaboration. And there are many specific strategies you can use around collaboration. But collaboration, embedded in collaboration, is inclusiveness. And remember that we have been in a very top-down environment. The new mandate, the new deployment, you have to get here, you can only get vaccinated if you're this age. Each day we're looking for the new rules. Inclusiveness is finding those places, those spaces where when you have a meeting, you can invite people's opinions in and listen to those opinions, repeat them back, and allow for voice and choice to be part of our lives again. Because once we've removed voice and choice, we've actually removed our feeling of being included in, and now we're excluded, and now it's us versus them, and our anger generates. And another area of collaboration is being able to engage in people's pain and understanding it and responding to it. so many strategies around collaboration, or even concrete strategies around collaboration, like asking if they have to return to work, asking people how they want their work site to look, giving them some sense of ownership or agency about coming back into the office. Just those kinds of things makes me feel more part of the process as opposed to just going back to it as if nothing has ever happened. So those are just some of the practices. There are many, many concrete practices that organizations can use.
So with our just last couple of minutes left, is there anything else that you had wanted to say in this conversation?
The only thing that I would add is that this actually does take some courage to be able to sit with people's pain and not, that's what I've heard some leaders say, like, I kind of don't want to ask the question because I don't know if I'm prepared to give the answer. Like, I don't know what to do with it. And so I just want to reiterate what Ken said is just a thank you for letting me know. Right? Thank you for sharing. That in and of itself can be healing without having to, you don't have to have any special words or strategies that take away the pain, because I don't think we can expect that we singularly can take away someone's pain, right? You're there, but you're there with them and you're not going to run away from it.
I believe with everything that we've talked about, as difficult as this year has been, as difficult as it is to understand and then address the inequities created by white supremacy and our institutional ways of creating bias, I have so much hope for the generation coming up and the kinds of conversations that are taking place and the integrity and curiosity of leaders these days to try to do something different. There's a hunger among healthcare professionals for more than the simple answer. And it's really the first time in my career I've seen this level of interest and desire to change really structural issues in how our organizations are organized, constructed, and implemented. And so, like in every crisis, there is an opportunity. And I do think there's an enormous opportunity for us to seize this moment and follow the workforce's lead and really build new organizational structures that are more humane, more attentive, and less inhumane. So I feel very hopeful from what I see and hear as we move forward.